Hi, I am Ruevick Charles Rio from the Pamantasan ng Lungsod ng Maynila College of Nursing, and today I am going to perform ostomy care to my patient, Mr. Poo. So right now I am wearing a mask so that it wouldn't affect my sense of smell because apparently the fecal material that collected in the pouch is quite smelly. So let's begin. Again, before we proceed to the procedure, we need to prepare our equipment first. So we prepare our equipment because it improves the efficiency of the nurse and it promotes the conservation of energy of the nurse. Because again, the nurse wouldn't have to go back and forth just to get the equipment that she or he have forgotten.
Equipments. Equipments include two pairs of non-sterile gloves, one pair for client if necessary, hydrated container, linen saver, basin of warm, soapy water, washcloth and towel, 4x4 inches gauze, room deodorizer, new pouch and wafer appliance, mirror, and pen.
Also, before proceeding to the procedure, we need to make sure that we assess. So we assess the patient so that we would know if the procedure that we're going to perform can still be performed to the patient or it is already contraindicated to the patient. So we assess in order for us to ensure the safetyness and proper delivery of the procedure to the patient.
Assessment should focus on the following: appearance of stoma and peristomal skin, dimensions of stoma to ensure correct bag and wafer size, characteristics of fecal base, abdominal status, teaching needs, ability, and preference of client for self-care.
So, magandang araw po. Ako po si Ruevick Charles Rio. Ako po yung nurse nyo ngayong araw. So, maaari ko po bang malaman yung inyong pangalan? Okay po. So, babalik po ako. Magpa-prepare lang po ako ng equipment tapos gagawin ko na po yung procedure.
Now let's proceed to the implementation. Number 1, perform hand hygiene, organize equipment, and prepare new stoma, pouch, and wafer. This reduces microorganism transfer and promotes efficiency.
I-prepare ko lang po yung mga gamit.
Next is explain the general procedure to the client and then explain each step as it is performed, allowing client to ask questions or perform any part of the procedure. This reduces anxiety, promotes cooperation, reinforces detailed instructions client will need to perform self-care. Number 3 is to determine if client is allergic to iodine-based antiseptics and use alternative if indicated. This avoids allergic reactions. And number 4, provide privacy to decrease embarrassment. After providing privacy to the client, make sure to position mirror to reveal stoma area to client. This allows client to observe and learn the procedure.
Ayan, so okay na po ako sa pag-prepare ng equipment at linis na rin po ako ng kamay. Ngayon po, i-explain ko na po sa inyo yung procedure. Bale, ang gagawin po kasi natin ay papalitan natin yung stoma pouch nyo. papalitan natin ito ng panibago. At the same time, i-measure natin yung um, lumabas na fecal material o yung mga dumi na nanggaling sa inyong tiyan. Kasi mahalaga po ito para ma-measure natin yung intake at yung anyong output. So, bale, matanong ko lang po, meron po ba kayong kakaibang reaksyon kapag kumakain kayo ng mga seafood tulad ng seashell? Okay, wala naman po. Meron po ba kayong kakaibang reaksyon kapag gumagamit po kayo ng mga betadine? Okay, so wala naman po. So, wala po kayong allergy doon. So, sasara ko na po yung cortina at ilalagay ko na rin po yung salamin para po matutunan nyo yung gagawin na procedure kasi eventually kailangan nyo pong matutunan to para sa sarili nyo. So, ito. Dito ko na lang po ilalagay sa may harapan nyo yung salamin. Ayan, so okay na po, nakaset up na po tayo, magsimula na po tayo.
After positioning the mirror, don gloves.
Okay, so maglalagay na po muna ako ng gloves. So, ayan. Maglalagay po ako ng gloves para po maiwasan natin yung pagkalat po ng infection. Yun po kasi yung pinaka-iniiwasan natin na mangyari dito, yung magkaroon po ng infection, lalo-lalo na bukas nga po ang inyong stomach. Ayan. Okay na po ako sa gloves.
After donning gloves, place linen saver on abdomen around and below stoma opening. This prevents seepage of feces into skin. Carefully remove pouch and wafer appliance and place it in waist bag. Safe tail closure for use. Remove wafer by gently lifting corner with fingers of dominant hand while pressing the skin downward with fingers of non-dominant hand. Remove small sections at a time until entire wafer is removed. Place 4x4 inches gauze over stoma opening.
So, begin na po tayo. Maglalabas lang po muna ako ng 4x4 na gauze pad. So, lalagyan ko na po ng linen yung inyong ilalim ng stoma para po hindi po malagyan ng dumi yung inyong balat. Ayan po. So, tatanggalin ko na po. Dadahan-dahanin ko lang po yung pagtanggal. Ayan, para hindi po masyadong sumakit. So, tanggal ko na po. Lalagyan ko na po ng gauze pad para po hindi po siya matuyo.
Tea pouch. Measure waste in graduated container before discarding and record amount of fecal contents.
Ayan, tulad po ng sinabi ko kanina, ay susukatin po natin yung dami nitong fecal material na nag-collect po sa inyong pouch. So, wait lang po, pinukapit ko lang po. Ito sa ating graduated container. So, i-discard ko na po ito. Okay. So, nasukat ko na po yung secretions na na-collect nyo dun sa, galing sa pouch. So, i-discard ko na po ito. Babalik po ako sandali.
Remove and discard clothes. Perform hand hygiene. And don fresh clothes.
Ayan na, sukat ko na po at na-discard ko na po yung na-collect natin or na-collect dun sa inyong pouch. So, ngayon po kailangan ko na po magpalit ng gloves.
Gently clean entire stoma and peristomal skin with gauze or washcloth soaked in warm, soapy water. If some of the fecal matter is difficult to remove, leave wet gauze or cloth on area for a few minutes before gently removing fecal matter. Rinse and pat dry thoroughly. This removes fecal matter from skin and stoma opening. Apply new pouch device.
Okay, so nakapagpalit na po ako ng bagong pair ng gloves. So, lilinisan ko na po yung inyong stoma at yung paligid po ng inyong stoma na balat. Ito ko lang po. So, yan. Tapos sa po sa stoma, yung paligid naman po na skin. No? so malinis na po siya. Maglalagay na po ako ng panibagong wafer po sa inyo. Bale, yung wafer po kasi na yun po yung pagkakabitan ng inyong pouch. So ito po, kakabit ko na po yung wafer sa inyo. At kakabit ko na po yung panibagong pouch. Yan. So, ayun po, okay na po, nakakabit ko na po yung inyong panibagong pouch.
Restore or discard all equipment appropriately. This reduces transfer of microorganisms among clients and prepares equipment for future use. Remove and discard gloves and perform hand hygiene to reduce microorganism transfer.
Ayan, so, okay na po tayo. So, tatanggalin ko na po yung mga tela na nasa inyo, tapos lilinisin ko na lang po yung paligid. Maraming salamat po sa pakikipag-cooperate.
Spray or room deodorizer if needed. This eliminates unpleasant odor.
Ayan, so, tapos na po lahat. So, gusto niyo po bang mag-spray po ng deodorizer sa kwarto niyo para po hindi po masyadong maamoy? Okay po. Okay po.
After performing all the procedures, make sure to document. Document the procedure completion with date and time and color, consistency and amount of fluid in pouch, condition of stoma and peristomal skin, abdominal assessment, emotional status of client, verbal and non-verbal indicators of altered self-concept during procedure, verbal and non-verbal indicators of readiness to perform self-care, teaching and client participation in performance of procedure, and lastly, additional teaching needs of client.
Okay, so the next thing or the last thing that we need to do is we need to ensure or make sure that we document the procedure that has been performed. Also, we need to document the color of the secretion, the consistency, and the volume. So, we document these findings in order for it to become a communication tool for healthcare professional as well as to ensure the quality of care that has been delivered. Because again, anything that has not been documented is considered not done. So that is all for my return demonstration of ostomy care to my patient. So, thank you and have a good day.